Welcome to mdsource, your source to helping you become a more informed you, with plastic surgeon Dr. Rod Rohrich. The nose facial balance and harmony.
Why is rhinoplasty so challenging? It is perhaps the most challenging operation we do in all of cosmetic plastic surgery. The nose is the central part and the most prominent part of your face, so it is key to providing facial balance and harmony. That's why it needs to be done correctly the first time. Careful attention should be taken when working with noses, commonly called rhinoplasty. It is truly an art because it is truly sculpture in the living. It is a matter of millimeters that can change a result from a good to a bad result. To start with, we want you again to take a look at the mirror test. It is important to look at the top 3 things that bother you about your nose and bring those with you when you come to see your expert rhinoplasty surgeon. Make a detailed list of the things that bother you based upon these 3 concerns and prioritize your thoughts on paper and bring them with you to your consultation. Because rhinoplasty is the most complicated thing we do, but it also is the one that actually has the most revisions in all of plastic surgery. So there are things that you may want to consider. Do you want to alter the bridge of your nose? Do you want to remove the bump? Do you want to reduce the width of your nose? Do you want to correct the shape of the tip? Is it too bulbous? Do you want to correct the size of the nostrils? Or the angle between the nose and the upper lip? It may be too long or too short. I think that addressing these 3 top concerns is very important with your rhinoplasty surgeon. And I use computer imaging as a great educational tool because I want to be able to show the patients what we can do and what they can't do. These are educational tools only. So it's very important that you understand what you can and cannot do. But focus on the top 3 things. If I can't help a patient with those top 3 concerns, I'm not going to operate on them. Not infrequently, I also suggest a chin implant in a patient because I look at the patient's face and their nose. And if you have a small chin implant may actually help your nose look better on your face. This is truly a way to improve nasal and facial balance, and certainly is not considered upselling. It's really allowing you to get the best result from your rhinoplasty. Not all rhinoplasty is strictly cosmetic, because many people will have nasal problems and nasal breathing problems as well. And as a rhinoplasty surgeon, I fix both the functional problems and the external cosmetic problems. So patients that have congenital deformities or physical deformities from trauma, they are also candidates for rhinoplasty. If you've broken your nose and have altered shape or function, that certainly makes you a candidate for rhinoplasty. Now, having said that, up to 50% of the patients I see in my practice are called secondary or revision rhinoplasty patients. This is where things didn't go well the first time. So the key is know before you go, because it is so important that your rhinoplasty be done by a true rhinoplasty expert. So how do you find that expert? You make sure they're either a board-certified plastic surgeon or a board-certified otolaryngologist that has expertise in rhinoplasty. There are 7 points in your checklist for rhinoplasty. Number 1, you got to choose the right surgeon. You must choose the right surgeon to get the best result the first time. That is so important. Number 2, make sure you schedule enough time away from work. Usually it's about 7 to 10 days. Number 3, do you want to be able to reduce the swelling in your nose postoperatively? Then you must avoid aspirin, Advil, Motrin, fish oil. Keep your head elevated. Don't exercise for 4 weeks. At least don't get your heart rate above 100. And then avoid wearing any glasses on your nose for 3 to 4 weeks as well. And what do you expect as a number 4? What is your normal postoperative recovery? Well, you may feel congested. You may have some swelling or bruising around your face. Those are all normal. And certainly feeling a little fatigue is also not uncommon. These are all things that are part of the normal postoperative regimen, including having, some dryness inside your nose. As a postoperative follow-up appointment number 5, I see my patients all at 7 days. I remove all the splint internally and externally and the sutures as well. And then we'll get you on a postoperative regimen. We're using nasal spray inside your nose. Number 6, when do you ease back into exercise? It's usually at 3 to 4 weeks. I don't want your heart rate above 100 for the first 3 to 4 weeks. And number 7 is, when is it all done? When is the final outcome? Well, the nose takes up to 12 to 15 months to see the final outcome. Sometimes longer if your skin is thicker, if you're a male, or if you had revision previous rhinoplasty. That may take 2 years. So what are 5 key points to remember about rhinoplasty? Number 1, rhinoplasty is the most challenging, difficult operative procedure we do in all of cosmetic surgery. So know before you go. Check the right and find the right rhinoplasty surgeon, either an ENT facial plastic surgeon or a plastic surgeon with expertise in rhinoplasty. And this is so true for both primary and especially revision rhinoplasty. Number 2, when will you see the final results? It will at least be a year or longer. Just remember that. If you have thicker skin, if you're a male, if you had revision rhinoplasty before, it may take longer. Be patient. Know that before you have your procedure. Number 3, make sure that your expectations match your concerns. I always tell my patients what I can do and what I can't do. And this has to be in sync with your surgeon. Okay, we operate with scalpels, not with wands. Okay, so that's very important. We do not perform miracles. We improve exactly what the concerns are. Number 4, a great rhinoplasty looks natural and balanced with your overall face. That's the key. It'll look like you've never had anything done. Number 5, as with all plastic surgery, give yourself adequate time to heal before you return to your prior level of activity.
mdsource with Dr. Rod Rohrich, helping you become a more informed you.